extraordinarily lucky to have this governor at this time by our side and in our corner.
Yes.
Governor Healey has been fighting for our rights for her entire career and is really, really good at it. It is my distinct honor to introduce Governor Maura Healey.
Well, good afternoon, everyone. It's really, really wonderful to be here. It's great to be with you, Julia. People probably don't know, but I worked with her dad for many years. He was a legend in the Attorney General's office and did really, really tremendous work. And Julia herself has worked in state government at the Department of Transitional Assistance and really understands the intersection of poverty and health outcomes and so much more. So, I wanted to come to the island. I've said I'm a governor for the entire state, as is your fabulous Lieutenant Governor, Kim Driscoll, who sends her regards. And we're really delighted to be here today. I'm also really delighted to stand alongside my colleagues and your representatives who are just outstanding, not just for the work they do in the district, but for the work that they do, for people across the entire state. And that's, of course, Senator Julian Cyr, who's fabulous, and Representative Dylan Fernandez. I also want to acknowledge who works here at Health Imperatives.
Yay!
Great. I'm going to want to take a picture with you.
Yes.
We just had an opportunity to tour inside. It's a beautiful facility. It's a welcoming facility, and it's exactly the kind of place that so many communities need. Certainly, the Vineyard has needed this for a long, long time. As we were speaking, about this, Nantucket, the Vineyard, these really have been places that are far too much of a desert for too many. Just aren't able to get the kinds of healthcare services that they need. And this is healthcare that we're talking about. It's basic healthcare. I also want to acknowledge, importantly, the folks on our state team who helped make this happen. Jill Clark, our director of Thank you so much, because we're talking about Department of Public Health grants that have come through to help make this possible, and I want to thank big time Jill for her leadership and work. I also want to thank her colleague Roberta Moss, who manages our sexual and reproductive health program for DPH. I think we understand right now where we're at. It's an anniversary of a really terrible, misguided decision by the Supreme Court. Something that a lot of people didn't think could happen actually happened with Dobbs and the Earl Fraternity of Roe. I have said that we will continue to be in Massachusetts a beacon of hope for patients and for providers here in Massachusetts and around this country, and I am deeply, deeply committed to that. I am grateful to our legislature who acted before Dobbs came out to make sure that we had in place the kinds of protections that we need, again, to protect our patients and to protect our providers. I had the privilege of working with the legislature as Attorney General. I have that opportunity now to do so as governor, and we've got a lot of work to do. There are a lot of people out there who are scared right now with state legislature after legislature and governor after governor in too many places signing laws that are taking away access to health care, access to reproductive care, access to abortion, access to gender-affirming care. And these are incredibly harmful, cruel policies and decisions that have such a detrimental impact, particularly on those who are poor, those people of color, and so many other particular, vulnerable populations. And so I think in the face of that, and at this time, it's wonderful to see that the state was able to come forward with grant funding that we're talking about here today. That has long been the commitment, and that will continue under this administration as well. I also am grateful for our partners here, folks from the hospitals. Daniel here? Yes, you're here. All right.
Oh, wow, there's a good honk.
Daniel Pesh, of course, the Chief Medical Officer from the hospital. Marina Lent from Aquina. Yes, well, our health agents are super, super important in our 351 cities and towns. And then Friends of Family Planning, Terry Young, President of the Board. So thank you for As Julia mentioned, this funding, $700,000, is going to help provide medication abortion at the 7 health imperatives locations around Massachusetts, the Cape, the Islands, and southeastern Mass. And those services will launch starting next week. So really, really impressed to be able to take this in and to see, the work that you're doing. And I just want to commend the staff as well, because it's also a very hard time to be in this space.
Yep.
The threats are real. The unfortunate concerns we have to have about security are real. And it's also day in, day out, you're seeing, pain and trauma lived through, those who are coming through the doors here. And that also takes a toll on providers. I just want to be really clear that whatever it takes, whatever we need to do as a state to support access to reproductive health care, to health care, which I believe is a human right, we are going to do. So thank you for the opportunity to come here today.